That was interesting, but it is a subject that I feel quite passionately about, because I think, you know, it wasn't that long ago that we just started telling people what happened in the research that they were part of for maybe days or weeks or months or years.
Yeah.
And it wasn't that far before that where we were actually telling them what we were doing. I mean, yeah, we can disrupt and we can innovate the way that we test people. And people are excited. We have the technology, we have the community.
I agree.
We need to completely redo the system.
Yeah, I agree. I couldn't agree 100% more with you. And I believe that sharing results with the patients also will include them in further studies. Oftentimes you hear when research is performed, patients want to have that feedback. They want to hear what are the results, how is my participation are going to benefit the healthcare system as a whole. And oftentimes when you see that they are not getting that feedback back, they are like, okay, what does it make any benefit for them then? Why do I have to participate again? Why do I have to give so much energy again?
Yeah.
So I 100% agree with you on that. I think the system is broken.
Yeah.
The system is more focused on actually making research, but not on doing it as a part of giving feedback back to the people that are participating in it.
Yeah, and doing it in a way that they can actually understand.
Yes.
And communicate to them. So much of medical data and information is written in a very complicated way.
Absolutely.
And if you've put in your blood, sweat, and tears, sometimes literally,
yes,
to be part of a subject, you deserve to completely understand what happened, what does it mean, where is it going?
How is it used?
And we have some guests.
Yes.
Kim and
Hello.
Kimberlie, hello.
Thank you.
Thank you for joining us.
Thanks
and thank you for
us.
being here.
Our pleasure.
Yeah, I met you last year. It was a thrill, and I think you did a fantastic talk and brought up one of my favorite topics, which I didn't know if I could squeeze into Digital Health Days.
Such a great question. I was thinking more about it after you asked it, that, you know, can we make mental health care completely, fully automated using artificial intelligence? And as I said on stage, I think you can go a very long way. And as machine learning gets better and better, artificial intelligence gets better and better, people ask the right questions, the right follow-up, given the right suggestions about how to rethink a problem or how to solve a problem, will get better and better. I think, though, as human beings, I still need somebody who cares. You know?
I couldn't agree more with you. I'm sorry that I'm interrupting you on that. Because this subject actually also goes myself close to heart. Since, as you can see, study after study shows that chronically ill patients have a lot of psychosocial issues going on, mental diseases, just insecurities, but also eating disorders, all these things that are just occurring with people that already have a chronic disease. And for myself, what I experienced in Europe, I've lived in many countries in Europe, and the majority of them actually do not ask so deep into, so how are you feeling right now?
Yeah.
What is going on in your life? I mean, diabetes is like a job that you haven't asked for. It was said before on the conference in here, it's like a job that you got, but you never asked for that. And you need to take it with you in every step of your life. So whenever you're in a relationship, work, or you're buying a new house, it always drags with you. And no one is there to give you an answer. And I believe that when you want to fully treat a patient, then you also need to look at the mental state of a patient as well. And one of the things that, after my study in Sweden on how diabetics are looking at how their education is in terms of the disease and the way that they have to manage themselves, a lot of patients noticed that they did not get fully support when it comes to mental health. I wanted to start up a study for that, and I'm still thinking about doing that, about using automation to analyze whether or not a diabetic is getting into a depression before that happens. But it goes into so many different stages and so many different details and variables and everything. And what I'm wondering about, when you were talking about Dr. Watson, Dr. Watson is currently being used as a hype. Almost every company that has been presenting themselves here is using Dr. Watson in some way or another. And that is great. I have to agree with that. But sometimes I wonder, is Dr. Watson now being put down as the oracle that everyone should be using, or should we always keep this down-to-earth approach where we also use our human approach?
Yeah, I would say, I was telling Kimberlie, When I first started training as a psychiatrist in 1978 at UC San Francisco in a psychiatric hospital called Langley Porter, the absolute best therapist, the greatest healer in the entire building, never went to college. She was a high school graduate. Her name was Dorothy. And she had a gifted personality. You know, we talk about intellectual gifts and athletic gifts and artistic gifts. Some people have gifted personalities. She could make you in 30 seconds feel like a phone call from you absolutely made her day. Wow. There was nothing more important to her than what was your concern. And
solving your problem.
And solving your problem.
It's the only thing that mattered to her.
Amazing.
Yeah, but she had her own little computer algorithm. This was 1978. We didn't have cell phones. We didn't have desktops.
No Dr. Watson.
We didn't have Dr. Watson. We had pagers. Voicemail was just starting to get introduced, but people still preferred a human being to take their message. But she had an algorithm. Okay, you want to change your appointment, I'll leave the doctor a note. You need to have your medicine refilled, I'll leave the doctor a note. You're feeling suicidal, I'll page the doctor. So she had basically a natural language keyword algorithm that would tell her to page or simply take an ordinary message. Now, Watson can do that perfectly. So Watson can be a triage person, can absolutely go through certain keywords. Watson can say, how can I help you? I need to have my medicine refilled, I'll alert the doctor. How can I help you? I'm feeling anxious. Watson can go to your treatment plan. Yeah. Have you done your meditation exercise? Have you gone for a walk? Have you worked your CBT exercises? Okay, I'll inform the doctor. So they can do a lot of the sort of triaging, the sort of front desk receptionist kind of role.
Something that crosses my mind now, you're talking about the natural language processing, which is depending a lot on the way your speech is formed, the way you use keywords, the way you interact with other people. Yeah. But when you're talking about these scenarios, you're talking about people like you and me. My girlfriend, for instance, has Asperger's disease. She has very much difficulties expressing herself emotionally and also talking about depressions and everything. So she keeps everything inside. How is Dr. Watson, or how is your idea on interpretation of this tackling with that? Because you can,
I had that question as well.
Yeah,
because what if someone is really not self-aware enough? And we see that with research when people are self-reporting. Sometimes they're just not reporting in a way that's
they need a lot of help with it. In many ways, I think Watson has Asperger's in the sense that, in the sense of it can make connections. So a patient I treat, for example, with Asperger's says to me, there's a boy and a dog, and they're together. The dog is hit by a car and injured, and the boy is crying. And I know the two events are connected, but I don't feel it. I don't feel the boy's, I know the boy's in pain, but I don't feel it. I don't feel the dog's pain, but I know those events are connected. Or I may feel it, but I can't express it. Well, Watson can do that. Watson can put together boy and dog together, one is injured, and they're both upset. Without necessarily having the ability to put into words or to empathize. So in some ways, there would be a certain kind of synergy. Watson, we also would know the limits of it. We know when Watson can pick up certain key words, and it may be confused by it. I was at a conference recently. I'm a consultant to a big software company in San Francisco that also has its version of Watson. They call it Einstein. And they just were able to, they actually beat Watson in a competition with a phrase. The phrase was, the best chance you have for enjoying the movie is to lower your expectations. So most artificial intelligence look at that as, that's a positive statement. It has hope and joy in it. But actually, it's telling you, lower your expectations
Yes.
if you want to put. But now they can figure that out. So again, as they get better and better and more sophisticated, they can look at the keywords not as just random keywords, but in a broader context. Still not perfect. You still need humans in the chain to help you catch it. And in terms of, we think also Watson can really help people with challenges in emotional expression and they're to express themselves, things like show them the emoji chart, pick the emoji, that best describes what you're thinking and what you're feeling, and help people start to put the words together. So I know I'm a believer in artificial intelligence as a huge assistant, but we're not replacing the human being.
But would you believe when you're talking about these cases, you're always reflecting towards emotions? So if someone feels depressed or if someone feels happy, but what if a person really lacks emotions? Like if I have a discussion with my girlfriend in this case, and we were talking about something very specific about holidays, and that happened something, I was very upset, she was very upset as well, but she showed pretty much no emotion. So for me, it's very difficult then as a non-Asperger person to understand what goes on in her mind. I don't understand how she is thinking. But how can a computer do that if there's a lack of emotions, a lack of keywords, and a lack of ventilation of inside feelings?
Yeah, so again, what the human brain is best at is the so-called unstructured data. I'm not only hearing your words, I'm seeing your facial expression, your body language, your tone of voice, all of that together.
The non-verbal communication.
Exactly. Well, Watson is working on that too. They have a visual image. They can look at your facial expression. It's getting better and better. It's not there yet. Okay. It will get better. But what you're saying as a human being, your girlfriend, you're noticing something's different. So she's expressing emotion to you in some way. Maybe she's more withdrawn. She gets quieter, or Asperger's, they often will have trouble making eye contact, but she's making even less eye contact. But you have some way of sensing something's up. And then you start there. So, but you've read something in her body language, her facial expression, her level of connectedness that something is off, and then you go from there.
Yeah.
You even said you knew she was very upset. Somehow you knew that. There was a pattern you were recognizing. Even like I have a way of expressing that I'm upset that smacks you in the face.
Yeah.
But you were perceiving.
Yeah.
And that pattern recognition and the ability to look at a delta, a change, is what Watson is one of the things Watson's really good at.
Yeah, and that also makes me wonder a little bit, because of course you have a valid point in there, but earlier I tweeted out a question whether or not our audience believed if digital health can replace or can help in this situation, and the majority of people actually said no. They don't believe that it can actually help, because you still need to have that interaction, that non-verbal communication.
Well, you can, as artificial intelligence gets better and better.
Yes.
It's much more interactive. Even now, I was shopping for a present for my wife last Christmas, and I was on a website for Neiman Marcus, and I thought I was talking to a sales girl until finally I got to a point where she said, hold the line, and then a person came on. But, are you looking for, an article of clothing? How about a coat? Are you looking for jewelry, a necklace, or a ring? I mean, you get pretty far before I realized I was not talking to a person. But anyway, I had a really fascinating conversation, I thought, a few months ago with a man who's built a company on cybersecurity. He's an expert in particular cell phones, keeping them secure. And so what does he do for a hobby? He's building a supercomputer in his basement to create artificial intelligence. Oh. And so I was talking to him about it, and I told him I thought he was going about it backwards, because we didn't start with the brain and then grow a body. We started as a single cell, then we were a chain of cells, then there is an evolutionary advantage to mobility. Then you had to have the first brain that can control left and right movements. Then you had to be able to fight or flee, so a brainstem gave you the fight or flight. Then we started to have babies outside our bodies, so we had to have emotions like love, or the baby would die, and we work better as groups, so we have to have guilt or shame. We also have to be driven by curiosity and surprise and joy and so on. Then we have the higher brain, which can anticipate and problem solve and so on. So we started with bodies and we went to the brain. So when you talked about an emotion, you also said feelings, and that's right. Emotions are feelings. We feel it in our body. I thought a really fascinating study I saw a few months ago was that if you get heartbroken, if your girlfriend or significant other dumps you and your heart is aching, and you take 2 Tylenol, the heartache diminishes. So the brain has a part of it that registers heartache. When we talk about, that disgusts me, that turns my stomach, that makes me sick. Some awful, horrific event is causing an abdominal reaction. We talk about gut feeling, our intuitive emotions. When we say somebody has a great heart, we don't mean how well the organ pumps blood. We mean his, capacity for love and giving and goodness. So the body, we feel in our bodies, and the brain-body connection, which goes both ways.
Wow.
Psychological events affect the body, but also one of the treatments for refractory depression that doesn't respond to anything else, is actually Botox. You give injections in the forehead so you can't frown. You can only smile. And when you're smiling, it evokes happier thoughts. So I think when the artificial intelligence, when the computer creates a body that, like me, gets some aches and pains as it moves around, I think we'll get more empathy, more compassion. But anyway, I just think it's a fascinating area.
This is a fascinating area.
But we believe that artificial intelligence is such a powerful tool that we should explore its application to behavioral health therapy. But really what we're focused on now is delivering evidence-based medicine at scale. And that's, from the United States, one data point that shocks me every day is that there are, in 55% of the counties in the United States, there is no one able to deliver CBT therapy. There are no psychiatrists, no psychologists, no social workers. No one is trained to deliver services for depression or anxiety.
Wow. And you would think that the barrier to entry or someone traveling, because there's enough of a stigma already with seeing a therapist and working on yourself, which is terrible. It's really terrible. But then traveling to one far away, that's a huge barrier to entry. And probably one not many cross.
Digital health is the only solution for tens of millions of people across the United States. It is the only solution for tens of millions of people across Europe. And so artificial intelligence is a tool I want to leverage, but delivering healthcare now using digital technology is, I think, quite doable.
Also, CBT does not require compassion or empathy. It has at the core, we want you to feel better, but CBT, Albert Ellis, one of the founders of CBT, along with Aaron Beck, just had a simple ABCD method. A is the antecedent or triggering event. B is the beliefs about yourself as a result of that event. C is the consequences of those beliefs, and D is how you dispute the beliefs. So in other words, if I ask a girl to dance and she turns me down, that's the antecedent event, the trigger. If I believe I'm a loser and nobody's going to dance with me, then the consequence is I'm miserable, I go home and I'll never go to another dance again. So if D, I dispute the belief and say, hey, I'm not a loser, good for me, I took a healthy risk, no one bats 1,000, ask someone else to dance, I feel very different, right? If I fail a test and I think I'm an idiot, I want to quit school. If I fail a test and I say, hey, I wasn't prepared, I've got to study harder and take it again, very, very different. So that's CBT just teaches you to reframe. Something happens, you have negative beliefs that trigger negative emotions, and you just counter the beliefs. That machine, that teaching, that tool can be done.
This is such an incredible field to talk in. We're running out of time. I could talk to you the whole evening. It's such a great guy and a great couple actually on this.
What I would just like to end with is I think it's a really exciting tool, like you said, and I hope that more people get involved with psychology and get involved with some self-reflection and some self-healing in a way that doesn't have any stigma, and maybe working with psychologists or psychiatrists doing that.
And I just want to one closing thought that I don't think artificial intelligence is as good yet as what I'm best at. I like to think of myself as compassionate and empathic, but it doesn't have my weaknesses either. It's more patient. It's more attentive.
It doesn't get stuck in traffic.
It doesn't get stuck in traffic. But it doesn't have biases. It's not sexist. No. It doesn't make assumptions. There are other kinds of advantages.
It's affordable, which you're not,
That's true.
It all helps.
That's
Great.
a fast.
Yeah.
Thank you.
So,
we're leaving it there.
Yeah.
That is perfect.
Thank you
I love
so
that.
much for your time and
thank
being
you.
here with us. And
It was really great to meet you. I hope to have a chance to talk with you again sometime.
absolutely.
Definitely.
Thank you.
Thank you, guys.
And thank you. And we are going to.
We're going to be back in not even 15 minutes.
Yes.
In the meantime, please follow us on Twitter and hashtag
Dhd16.
We started to talk at the same time.
Yeah. Thank you so
And
much.
we'll be back
Thank
soon.
you.
Thank you so much.
Bye bye.
Bye.